Before you start taking Odefsey, make sure to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth with a meal as directed by your doctor, usually once daily. It's important to note that medications which reduce or block stomach acid, such as proton pump inhibitors, PPIs, H2 blockers, or antacids, may reduce the absorption of rilpivirine, making it work less well. Therefore, do not take PPIs while using this medication, and if you take antacids, make sure to take them at least 2 hours before or at least 4 hours after taking Odefsey. For H2 blockers, take them at least 12 hours before or at least 4 hours after taking this medication. It's crucial to continue taking Odefsey exactly as prescribed by your doctor. Do not take less of this drug than prescribed or stop taking it, as this can cause the amount of virus to increase and make the infection more difficult to treat. Do not increase your dose or take this medication more often than prescribed. For the best effect, take Odefsey at evenly spaced times, and to help you remember, take it at the same time every day. If you experience headache or trouble sleeping, it's important to let your doctor or pharmacist know. Odefsey is prescribed because the benefit to you is greater than the risk of side effects. As your immune system gets stronger, it may start fighting off infections you already had, which could cause disease symptoms to come back. Get medical help right away if you have any serious symptoms, such as unexplained weight loss, severe tiredness, severe headaches, joint pain, and signs of infection. Tell your doctor right away if you experience signs of kidney problems or mental/mood changes. Odefsey can cause changes in body fat, and it may also cause a rash. If you have any concerns about side effects, it's important to talk to your doctor. Before starting Odefsey, it's important to inform your doctor or pharmacist if you have any allergies to emtricitabine, rilpivirine, or tenofovir, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to discuss this with your pharmacist. Additionally, it's important to share your medical history with your doctor or pharmacist, especially if you have kidney disease, liver disease, such as hepatitis B or C, cirrhosis, alcohol use, bone problems, such as bone disease, bone loss/osteoporosis, weak/broken bones, or mental/mood disorders, such as depression. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For pregnant individuals, Odefsey should only be used when necessary. It's important to discuss the risks and benefits with your doctor. This medication can lower the risk of passing HIV infection to your baby and may be part of that treatment. Lastly, if you are breastfeeding, it's important to consult your doctor before breastfeeding, as this medication can pass into breast milk and potentially transmit HIV. It's important to be aware of potential drug interactions that could affect how Odefsey works in your body or increase your risk for serious side effects. Make sure to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Odefsey include adefovir, orlistat, other drugs that may be harmful to the kidneys, and proton pump inhibitors. It's important not to take this medication with other products that treat HIV infection or contain emtricitabine, tenofovir, lamivudine, or rilpivirine, unless your doctor has approved it. Additionally, be aware that other medications can affect the removal of rilpivirine from your body, which may impact how Odefsey works. Examples of such medications include dexamethasone, macrolide antibiotics, rifamycins, St. John's wort, and certain drugs used to treat seizures. Always consult with your doctor or pharmacist before taking any new medications alongside Odefsey. If you suspect an overdose and the person is experiencing serious symptoms like passing out or difficulty breathing, it's important to call for emergency assistance right away. In the U.S., you can contact your local poison control center at 1-800-222-1222, while residents of Canada can reach out to a provincial poison control center. Symptoms of overdose may include a fast or irregular heartbeat, severe dizziness, and fainting. Before taking Odefsey, it is important to note that this medication should not be shared with others. Additionally, it is important to undergo lab and/or medical tests before starting Odefsey and while taking it. These tests may include kidney/liver function, hepatitis B virus test, viral load, T-cell counts, blood mineral levels, bone density tests, and urine glucose/protein tests. It is crucial to attend all medical and lab appointments and consult your doctor for more details. Odefsey is a medication used to treat HIV-1 infection in certain patients. It is typically taken once daily with a meal. It is important to take Odefsey at the same time every day for the best results. Be sure to follow your doctor's instructions for the correct dosage and optimal timing of this medication. If you forget to take a dose of Odefsey and it's within 12 hours of your usual dosing time, take it with a meal as soon as you remember. But if it's been more than 12 hours, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Odefsey, it's important to keep it at room temperature, away from light and moisture. Make sure to store it in its original bottle and away from the bathroom, and always keep medications out of reach of children and pets. When it comes to getting rid of any expired or unused Odefsey, it's best to consult your pharmacist or local waste disposal company rather than flushing it down the toilet or pouring it into a drain. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.